Family Partners is a strengths-based program that helps families grow together by offering home and community-based counseling, along with a variety of other services to help support children and their families. Family Partners is contracted with Fairfax, Arlington, and Loudoun counties, and the City of Alexandria to provide services. Our services are also available to in other surrounding areas if we have staff available. And with our new telehealth options, we're able to expand those areas even more than what we were previously serving. We're also currently providing services in English, Spanish, Japanese, and American Sign Language, and are always looking to bring on additional bilingual staff to increase these options. Our services are funded through CSA County funding, Medicaid, and private pay options. While we're not currently contracted with private insurance companies, we do help support families working with their insurance companies to see if they're eligible for reimbursement through their plans. Family Partners is also licensed under the Department of Behavioral Health and Developmental Services. We adhere to all DBHDS human rights and county regulations, and we have a designated compliance coordinator that helps ensure our standards are upheld and continuously monitored. The Family Partners team is comprised of qualified and experienced staff and clinicians. We have licensed mental health professionals, board certified behavior analysts, social workers, marriage and family therapists, counselors, and residents in counseling. This wide variety of staff allows us to serve and meet the needs of the many different children and families that we serve. All of our clinical staff are QMHP certified, which stands for Qualified Mental Health Professional. This certification is overseen and regulated by the Board of Counseling. All of our clinical staff are required to keep and maintain their certification current in order to provide services. Each of our clinicians has their own individual areas of specialty and training. They're each trained in various approaches and evidence-based models. All of the approaches applied in treatment through all of our different services are determined individually based on the client and the family's needs. We provide home-based services, which is referred to often as either intensive in-home, family support services, or individual support services. We also offer therapeutic supervised visitation services and outpatient services, including a new outpatient service called PCIT, which I'll discuss a little bit more in a moment. We do family mentoring, which is a service that we're specifically contracted with Loudoun County to provide, but also would be open to providing in other areas if there was interest. And we offer a few different parent classes. We have a Strong Families Parent Education class, which is an interactive parent education and processing class that also has a really cool individual component that involves a consultation session, which is included to help families apply what they're learning in their own specific situations. We have a de-escalation crisis intervention parent training class, which is based off of an evidence-based model called Right Response. And we're also in the process of starting a parent support group for families dealing with the current pandemic and supporting their kids while being home with them. So we've always provided school refusal services through our home-based services, but we are working on getting a specific evidence-based treatment program called Coping Cat started. This model is based on practices we are already implementing, but will help formalize the process and the services we provide. And something many people may not be aware of is that we also provide comprehensive autism diagnostic testing. So I referred earlier to a new outpatient treatment that we're going to be providing. It's called PCIT, which stands for Parent-Child Interaction Therapy. PCIT is a short-term evidence-based behavior parent training treatment for children ages 2 to 7 who exhibit disruptive externalizing behaviors, anxiety, ADHD, have experienced trauma, and parent-child relationship problems. There's also an array of research that shows it can be beneficial for many other needs among the parent-child interactions. PCIT and PCIT-based programs are also evidence-based interventions for preventing child abuse and neglect for decreasing the child's risk of antisocial and negative behavior later in life. PCIT is aimed at parents, foster parents, and other caregivers that may be primarily in the child's life. The parent or caregiver and child participate in every session together, and the average length of treatment tends to be typically between 12 to 20 sessions. Treatment length does vary based on each family's specific needs. So what does PCIT really look like? So PCIT typically takes place in the office setting and is considered an outpatient therapy model. It's 1-hour sessions that take place once a week, and then families are expected to practice those skills between the sessions when assigned. The parent or caregiver plays with their child in one room while the therapist observes and coaches from an adjacent room equipped with a one-way mirror. The therapist communicates with the parent through an earphone, or they call it a bug in the ear, providing training and guidance to the parent during the section. And we actually are also able to offer PCIT via telehealth, which is very exciting because considering the current pandemic, we're able to provide this therapy even though we may not be able to be in person right now. So there is a lot of research and evidence that shows that PCIT is just as effective virtually as it is in the office setting. Now, our clinical supervisor, Dr. Rhea Caracosta, will be sharing some information about the clients we serve and our approaches to services.
Thank you, Carrie. When we accept a referral for home-based services, we have a process in place to assign the clinician with the best skill set to meet the family's needs. Sometimes we assign 2 clinicians if the clinical needs of the family would benefit from that. The families we serve face an array of challenges ranging from early trauma and attachment issues, mood disorders such as anxiety, depression, and difficulty regulating emotions, to behavioral issues and school avoidance and refusal. We use a collaborative approach with the families we serve. We sensitively listen to what their needs are and what they need help with. Joining the family system and engaging with the family as a whole is our first priority. We work with all family members by holding individual youth sessions, parent sessions, sibling, and family sessions. While we focus on addressing problematic issues, we also identify their strengths and develop our interventions building on those strengths and based on evidence of what has proven effective in the literature. We meet them where they are. With sensitivity and acceptance of individual and cultural differences, we develop a shared vision of what things will look like when our journey together is completed, and develop a treatment plan. We always keep in mind that services will eventually be terminated, and we strive to leave the family at a better place, able to carry on the plans we implemented. We take into consideration and work with all systems that a young person operates within: the family, the school, and the community. We assess what may have inadvertently served to maintain issues and make necessary changes. We work on providing a sense of safety and stability to the family by helping establish daily routines and schedules and putting in place behavior modification plans. We help strengthen and improve communication and relationships within the family. We customize interventions employing cognitive behavioral therapy and dialectical behavioral therapy to address cognitive distortions, destructive self-talk, and distress tolerance. Our interventions are a blend of psychodynamic and systemic thinking. We use play and art and try to be resourceful in delivering services in an engaging way. We collaborate with other professionals, such as psychiatrists, outpatient therapists, mentors, and of course, school staff, and make necessary referrals to services in the community as part of wraparound services. Finally, as we get closer to discharge, we make sure families are linked to step-down services, such as outpatient therapy, if not already in place, and other community resources.
To learn more about these services or make a referral, please feel free to call us at 703-658-9054, and our intake coordinator can provide much more information on any of the services I just shared about.